Hello. Good afternoon. How are you?
Yeah, I'm good.
Uh, Sir, so before we start with the session, I would like to audience topic of our discussion. I think
But I
of
don't know.
hello.
Yeah, tell me. Yeah, it's audible.
So yeah, I just wanted to tell the topic of discussion today. So we will be talking about understanding the risk factors of diabetes types. So before we start the session, sir, can you please introduce yourself to our audience?
Yeah. I am Dr. Arun Kumar. I am practicing diabetic foot care around Neyveli for the last 2 years.
That's that's great, sir. Sir, so starting off with some basic questions regarding diabetes. Sir, so what are some common symptoms of diabetes and when should someone seek medical attention if they experience these symptoms?
Mostly the diabetic symptoms will be, most of the patient we will find the by random screening only. And the most common symptom everyone will face is the polyphase, the more thirst and more frequent urination. That too, nocturnal urination will be more in the patients of diabetic, and that leads to weight loss, severe weight loss, and muscle cramps, multiple disorder, pain, things like that. And due to the excessive urination and the increased sugar content in the urine, they may have a burning maturation, they may develop UTI also, and there will be a muscle fissures in the genitals in the patient who has a chronic diabetic. And most of the time patient will be asymptomatic. We will be screening the patient, and for random checkup they may have diagnosed as diabetes. And when the blood sugar is very more only, they used to have the symptoms of diabetes. And dehydration will be one of the typical symptom, and the patient will feel severe weight loss, and they should definitely seek a medical attention when they have a burning maturation, which may lead to urinary tract infection, may lead to pyelonephritis also. And the patient may have leg cramps during night time, and there will be a delayed wound healing if they have a ulcer or anything. And sleep disturbances sometimes will be due to the symptoms of nocturia at the night. And sometimes the patient may have a blurred vision symptom also when they have a more blood sugar levels. And most
Okay,
probably the patient, if they are symptomatic, they will definitely come for treatment.
right.
Only asymptomatic patients we need to be screened.
Okay, sir. Sir, so keeping that in mind, sir, what are lifestyle modifications or habit that can help in managing diabetes effectively?
Um, Actually, the diabetes treatment has a four pillar, we used to say, and the drug is one of the choice. In the four pillar, drug is just a pillar. The other three is what very important. The three is the lifestyle modification which we needed. One is physical activity. Out of the four pillar, one is physical activity. Previously, it was around 150 minutes per week, which is 25 minutes for 5 days a week. We used to say. Then recent guidelines of ADA and everything recommends is patient records minimum 300 minutes per week. That is a 50 minutes per day duration with 25 minutes of intensive workout during the physical activity, which promotes the decrease in weight, which promotes decreases the insulin resistance also. And and next to physical activity, they can do the yoga and the aerobic, anaerobic, anything is okay. Cycling will be best. The best choice will be a swimming, which is to useful to patient which they may not have very tiredness while swimming also. And the second pillar will be a diet. Diet is a required modification a patient need to do in their lifestyle modification, which they have to take the food of low glycemic index foods they have to take, other than the high rice like that. Brown rice will be a good thing in their diet, and millets they can add, and more green vegetables. And the food portion platter, that will be a best choice for the patient. We used to show a food platter to our patient which has 50% of green vegetables, and 25% is carbohydrate, which we use that we use 75% of carbohydrate and only 10 to 15% of other things. But the ideal platter for a diabetic patient should be 50% should be green vegetables, and 25% for protein, and 25% only for the carbohydrates, which we take more. and he can add other sugar-free items like the stevia or sucralose. They can add in their diet also. And other next thing is diabetes education, which 90% everyone will neglect in giving the patient, because we learn about diabetes and everything. The patient will not be aware of it, so they will never accept for the treatment unless they learn into a complication. So if we are giving them a proper diabetes education, they will definitely accept the treatment which we are providing. So we should use the third pillar, which everyone will neglect. Is just we will give a diet advice, we will tell them to do lifestyle modification, we will give them drugs. But we don't have in the busy schedule, we will never have a time to explain them what is diabetes and what are they should do in that thing. It should be a part of a treatment. In the lifestyle modification, diabetes education is a part of a treatment. And the next thing is drug. Other than that, we have to counsel the patient's family also, their moral support, because the patient will be in a severe, too much stress that they feel that they have the disease which they are going to have till they die. So they will be very stressful and they will have depression, many things. So we need to counsel their family members for their support also. And we have to, if the quality of the life after the diagnosis of diabetes will change. Obviously, a daily wages, their income, everything will be changed. So you have to give them counseling regarding the quality of the life and how to go through everything in the future.
A pretty serious and a complicated disorder. So, what are the potential complications of diabetes, and how can they be prevented or managed?
The diabetes complication most probably will classify it into micro and macro vascular complication. But I feel it should be the recent few guidelines. It shows acute and chronic complications. It should be treated. The patient need emergency treatment. So in the acute complication, and you should be knowing about it. Everyone from the practice, not only a diabetologist or a physician, everybody at a point of the time they will have a patient with diabetes in any specialty they see. So they should know about the acute complication. The main thing is hypoglycemia. That hypoglycemia and diabetic ketoacidosis and hyperosmolar state. These three are the acute complication in diabetes. And the hypoglycemia is due to the age of the patient. Old age people may have a recurrent hypoglycemia, and the patient under depression might have a hypoglycemia. And the patient who tries to do aggressive glycemic control at the initial stage may have episodes of hypoglycemia. And the multiple insulin injection patients may have the episode of hypoglycemia also. And we can prevent this by basic diabetes education is better in preventing hypoglycemia. Tell them about the symptoms, what they have to do, and the insulin, regular insulin, 3-time insulin patients, we can tell them about 3 meal and 3 snack pattern. This all will help them in preventing the hypoglycemia episode. And in the DKA and diabetic ketoacidosis and the hyperosmolar state, the most common, it is due to the increased blood sugar level and other symptoms like UTI and infections, acute MI and serious strokes and pregnancy, and many other sometimes drug induced like SGLT2 inhibitor may also cause DKA. So like that, many steroids, the thing are there. So the basic thing is patient need to be screened for the complications, and the patient should have their blood glucose under the control. And when we go to chronic complication, it will be like a micro and macrovascular complication, because that will be in a long-standing diabetic patient. And microvascular is diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. And most probably the first thing will occur is diabetic neuropathy in majority of the patient. And it can be screened with just 10-gram monofilament at the OPD itself. We don't need any just hi-fi equipments, anything. Just a 10-gram monofilament. With that, we can screen every patient for diabetes, and it should be done every 6 months once to a normal patient to see whether they have a protective sensory loss or not, they are going into neuropathy or not. And the retinopathy, we have to screen it at the diagnosis of the diabetes in both the type 1 and type 2, and 5 yearly one, and from next 5 years for type 1, and every year for type 2. And nephropathy, yearly once there should be a screening of urea creatine, EGFR, and microalbuminuria to the patients if they are they doesn't have any kidneys, any high elevated blood urea level or creatine level. And when we go to the macrovascular complication, it will be like CVA and the CAD. And they may have now recently they are having silent ischemic attack also, which the patient doesn't feel any pain due to autonomic neuropathy of diabetes. And there is also stroke, most common now it is there. And other symptoms like erectile dysfunction is a chronic symptom nowadays, and patient stresses, stress induced, and diabetic dyslipidemia is many recent complication for the MI thing, where patient will have only increased triglycerides and they require treatment for it. And now multiple skin disorders also being there in the patients. And recently there are few studies shows that patients sometimes develop cancer also due to the diabetes. And most common thing we'll see nowadays is non-alcoholic fatty liver disease is also due to diabetes.
Okay. Sir, speaking of the risks related to diabetes, so what are the specific genetic and environmental risk factors associated with the development of type 1 diabetes?
Type 1.
Yes.
Yeah, type 1, it always occurs in younger age, and it due to lot of causes. Genetic, like the thing is, HLA genes will be more commonly involved in the type 1 diabetic, which and there are many other genes like CLTA4 and CD4, like that, many genes. And most commonly due to their parents and genetic previous history in the metabolic memory also plays a major role. And other genetic factors we can determine before the, instead of doing genetic profile for the gene profile for the patient, we can go for the autoantibody test in the patients, which will be easily diagnosed even before the patient develops diabetes also, like insulinoma antigen 2 and insulin autoantibody, zinc transported state antibody, and GLUT4 antibody. That antibodies will be available in the blood even before they develop into diabetic. And the environmental factors such as vitamin D deficiency plays a major role in diabetic, type 1 diabetic in the younger adults. And viral infections such as rubella, cytomegalovirus, they also play a major role. And other than that, we can ask for the GDM in mother, the high birth weight baby, and baby with low birth weight also, and sudden weight gain in the baby also may lead to type 1 diabetes. And most commonly the rubella plays a major role in type 1 diabetes. And there are few cases that shows that at younger age the person who tries to eat rat poison develops type 1 due to beta cell destruction. And the most way to protect it is giving vitamin D supplements to the fetus when they are very young.
Okay, sir. Now, talking about type 2 diabetes, sir, how does obesity, lifestyle, and family contribute to the risk of developing type 2 diabetes?
You are asking that they plays the role or prevention of type 2? I
So,
don't
like,
get it.
what does it contribute? What role does it play in
Yeah, the obesity leads to the increased insulin resistance. And the same thing goes with the high glycemic index foods in the food. It will promote the increased insulin secretion. That in turn leads to increased insulin resistance in the thing. And lack of physical activity also, like high calorie intake and low energy excess. We are not using the energy which is present on us. So that the lifestyle plays a major role in the type 1 diabetes, type 2 diabetes. And the most common thing is physical activity and diabetic. And the obesity reducing 5 to 10% of the weight in the body weight prevents risk of developing type 2.
Okay. Sir, so coming back to our main topic, talking about the risks involved. Sir, so are there any specific risk factors for gestational diabetes, and what are the potential implications for both mother and baby?
In gestational diabetes, the most risk factor is the maternal age of the mother. When they are going in the higher age, it will be there. And the ethnicity of the previous, their mothers, and their genetic factors plays an important role in GDM as their parents are there. And the previous unknown abortions and loss of the